Hi, I'm Meg Callahan with Infectious Disease Special Edition, and I'm here with Jonathan Anderson, who is the Vice President and Head of Medical Affairs at CSL Seqirus. Did I say that right? You were talking me
Yeah,
through right before we started recording about how to pronounce it. Did I say that right?
it's CSL Seqirus.
Okay.
So it's pretty good.
Okay. Maybe like a B minus there, but at least I'm working on it. Why we wanted to talk is we wanted to talk about flu vaccines, and there was some new interesting data that came out. Maybe do you want to start with that?
Yeah, why not? So this is a cluster randomization study that's been conducted in nearly 430,000 older adults in a real world setting. And what we found with this study is that in this real world study, the adjuvanted and also the high dose influenza vaccines provided comparable protection against laboratory confirmed influenza in adults 65 years and older during the 2023 to 2024 influenza season. And what's interesting about that is these findings really reaffirm the ACIP's previous preferential recommendation that older adults receive either an adjuvanted or a higher dose or a recombinant influenza vaccine.
So why is that? Why would you want to give them a higher dose?
Well, older adults, as perhaps I'd better answer this way, as we grow old, and for some of us, that's already happening, obviously. But as we grow old, our immune systems don't operate quite as well as they did when we were younger. So those of us who are older adults need vaccines that are particularly designed to overcome the challenges that old age brings in terms of response to vaccines. And one of those approaches is to adjuvant the vaccine. And an adjuvant helps enhance the immune response that we have to new antigens or to antigens like influenza. Now, older adults are particularly important with influenza because if we look back at the statistics for the 2025-2026 influenza season in the USA, the Centers of Disease Control estimate that 65-year-old and older adults have accounted for an estimated 53% of flu hospitalizations. And so that this is a particular group for whom influenza vaccination is important. So that's why this data is important, and that's why it's important that healthcare providers think about vaccination, particularly of older adults, because it's a group that will benefit particularly well from vaccines that are designed for older adults.
Now, you'd mentioned about the ACIP recommendations. So when it came to this study, was anything surprising to you, or was it kind of what you thought was going to happen?
It was kind of what we expected to happen because we have a body of evidence around these vaccines, both the adjuvanted and higher dose vaccines, over a number of years that have shown that these vaccines are comparable between the adjuvanted vaccine and the higher dose vaccine. So from the perspective of the body of evidence, this was not a surprise to us. What was always good with real world evidence is that we continue to confirm the value of these vaccines in real world settings. As influenza changes every year and the vaccines change every year, it's important to have real world data to help inform the value of these vaccines in the population as it is now.
I think we kind of already hit what do providers need to know, but was there anything else that you wanted to add?
Yeah, what I would do is encourage providers, and I'm a GP by training, myself a family physician by training, and what providers need to know about influenza vaccination is that they are the most important person in the link between influenza vaccine and getting it into the arms of individuals, because their recommendation, that their trusted recommendation, is a very important force. And so take the opportunities that you get when someone comes in for other illnesses to take the opportunity to vaccinate those older adults with one of these enhanced vaccines that are designed for those older adults. And so it's important for them to know that they are the critical link between the vaccine in the fridge and the vaccine in someone's arm. And it's only vaccines in arms that will protect against influenza.
So I'm curious, could you talk a little bit about your company and what your offerings are and your vaccinations?
Yeah, so we're an influenza vaccine company predominantly. And we've been interested in looking at different ways that we can develop influenza vaccines. We have vaccines that are cell-based, they're grown in a cell-based culture. We have vaccines that are adjuvanted. And we also have these vaccines not just for seasonal influenza, but we operate in preparation for any pandemics of influenza as well. And work very closely to prepare in case for when, not the if, we have another pandemic of influenza in the future. So we're a vaccine company focused on influenza, on seasonal and pandemic influenza, and we operate around the world in the United States and in Canada, but also in Europe, Latin America, and the Asia Pacific. And we're really focused on the public health benefit of vaccination as one of the interventions that are very important, particularly in this case for older adults.
And I had seen recently that there was an agreement made with, was it the Pan American Health Organization and Latin America for pandemic flu, correct?
That's right. We've had a number of agreements with a number of countries and a number of organizations around the preparations for pandemics of influenza. And one of the things that we do as a company is work with organizations like the Pan American Health Organization to prepare for pandemics of influenza from our facilities that operate in the United States, in Australia, and in the United Kingdom. And one of those most recently, as you say, was the one with the Pan American Health Organization. So we welcome these kinds of partnerships with public health authorities so that we can be prepared and ready when we have another pandemic of influenza.
Dr. Anderson, thank you so much for taking the time to talk to me.
It's my pleasure. And just for your listeners or viewers, I re-emphasize the importance of the healthcare professionals as the link between vaccines in the fridge and vaccines in the arm. And so often we want to get on with the rest of the consultation, but it's so important just to take that moment and say, have you had your flu vaccine this year? Because that's so important for the health of your patient.
Very good. Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.